Pathology of osteoarthritis. The human body is supported by a skeleton of bones. The junction of two bones is a joint. In a joint, the ends of the bones are covered by a slippery tissue called the cartilage. The cartilage allows the bone ends to slide over each other. It also acts as a shock absorber and protects the bone ends. There is a small amount of synovial fluid present in the joint. It serves to nourish the cartilage and makes it slippery. The joint is covered by a thick membrane called capsule and by strong bands running on either side called ligaments. The ligaments, capsule and muscles around the joint prevent the bones from moving too much and hence keep the joint stable. In osteoarthritis, the cartilage degenerates. The cartilage becomes rough and develops cracks. This causes the bones under the cartilage to rub together, causing pain, stiffness, and swelling. The bone underneath the cartilage becomes thick and grows on the edges, forming spurs. Pieces of bone and cartilage may break off and float in the joint space, causing more damage and pain. The ligaments slowly thicken and contract. The muscles around the joint may weaken and become thin. This causes the joint to lose shape and the skeleton develops a deformity. The osteoarthritic changes in a joint can be seen in an X-ray of the joint. The space between the bone ends is seen to be reduced due to thinning of the cartilage. Under the damaged cartilage, the bone thickens and on the edges form spurs. The normal alignment of the bones is disturbed. Knee replacement. In osteoarthritis, the patient suffers from pain and stiff joints. The range of motion of the joints is reduced and the joints may have lost their normal alignment, causing a deformity. An incision is made on the front of the knee to allow access to the joint. Once the joint has been entered, pieces of diseased bone are removed from ends of the thigh bone and shin bone. The knee prosthesis is then fitted on the prepared surfaces. It is attached in a manner that the original alignment of the joint is restored, removing any deformity if osteoarthritis has made your knees knocked or bowed. After rehabilitation, in most cases, the artificial knee cures the pain and restores the range of motion of the knee to nearly normal. Arthroscopy. Arthroscopy is the examination of the internal structures of the joint by inserting into the joint a specially designed instrument called the arthroscope. It is usually done to see the damage inside the joint. If actual repair is performed, the procedure is called arthroscopic surgery. The arthroscope is a tube having a magnifying lens and glass-coated fiber to send concentrated light into the joint. A camera attached to it allows the surgeon to view the image of the joint's internal structures on a monitor. If necessary, a video recording can be made. Arthroscopy is a same-day surgery where the patient is admitted just before the procedure and allowed to go home a few hours later. To perform arthroscopy, the surgeon first numbs the area around the joint with an anesthetic so that the patient will not feel any pain during the procedure. He then makes two small incisions on the joint called portals through which the instruments can be inserted. After this, the joint is inflated with sterilized water. This makes the joint space expand and gives a good view of the internal structures through the arthroscope. The main advantage of arthroscopy is that it permits direct examination of the insides of the joint, which helps to accurately diagnose the problem. Moreover, since the incisions made on the joint are small, the joint heals faster and helps the patient get back to work sooner.